Hi, I'm Dr. James Machino, and I want to talk to you about alleviating period cramps or menstrual cramps that are associated with PMS and PMS management. Now, you know, in PMS or premenstrual syndrome, there's often a cluster of variable symptoms that occur about 7 to 14 days prior to the onset of menstruation. And in some cases, of course, what happens is with that, there's very painful menstrual cramps, or what we call dysmenorrhea, as part of the whole constellation of symptoms. About 1/3 of premenopausal women actually have some PMS symptoms, and you know, a certain percentage of those also get the really bad menstrual cramps. And this is most prevalent in women 25 to 40 years old. About 10% of women have really severe debilitating PMS symptoms, which often include menstrual cramps where they'll have to almost take a day or two off work or from school because the symptoms are so bad. So, you know, what's causing this? That's really been the eternal question. And what we're seeing, a very common finding in PMS and these sort of menstrual cramp disorders, is a very high progesterone to low, very high estrogen to low progesterone ratio. Too much estrogen, not enough progesterone. How does it happen? Well, just from faulty dietary behaviors, you can actually raise your estrogen levels too high, or the liver's not detoxifying estrogen fast enough. And those things can be dealt with nutritionally, to be quite honest with you. And sometimes back in the ovaries are not producing enough progesterone from what's called the corpus luteum in the second half of the menstrual cycle. And there are supplements that can actually raise that progesterone in a natural way. So, you know, for what we have seen now in terms of treatment for menstrual cramps, you know, in terms of the medical world, the treatment is often giving women painkillers or muscle relaxants or anti-inflammatories. So it addresses the symptoms but not the underlying cause per se. And those drugs have side effects. Things like aspirin and ibuprofen and Motrin and those things can lead to ulcers and bleeding disorders over your lifetime. Muscle relaxants can make you drowsy. There's addiction potential if you take stronger pain-killing medications. All of those drugs, including acetaminophen, can cause liver and kidney damage. So relying on them too much is not the best idea. I'm not saying you can never use them. I'm just saying if you can find a way to decrease your reliance on them, you'd be better off. And if you can bring the estrogen-progesterone ratio back into balance, that's really the best thing because that gets to the root of the problem. And that can be done with natural interventions. So the things that I've seen work include black cohosh with soy extract with gamma arosinol. Gamma arosinol comes from rice bran oil. But black cohosh, let's look at this now, has active constituents that are actually antispasmodic. They can actually block those uterine contractions and alleviate a lot of that muscular pain that's coming from the muscular coat of the uterus itself. It also tones down the overactivity or overstimulation of estrogen on breast tissue and on the uterine tissue. Isoflavones from soy do the same thing. They tone down estrogen, they help to detoxify estrogen in the liver, and they inhibit too much estrogen synthesis in your fat cells, which is the secondary source of estrogen. And gamma arosinol from rice bran oil, my experience is that it works very synergistically with both black cohosh and soy extract. And then there are some other supplements that have been shown to be useful, like vitamin E and B6 with magnesium, a low-fat, high-fiber diet, and some other lifestyle factors. So the truth is that a lot of these PMS symptoms, including dysmenorrhea or painful menstrual cramps, can be resolved by using the proper nutrition, lifestyle, and supplementation approach. The problem is that most medical doctors in medical school don't see a lot of nutrition and natural medicine. There's no time for it in the curriculum, so they're often not going to be in a position to give you that kind of advice, so they just move towards prescription drugs. But if you're looking for a way to get out of this in a more natural way, then I've put together a booklet called The Natural Management of PMS. It's available right here. If you have any PMS symptoms, if you have menstrual cramps, you should download it immediately because these are the natural things that have been shown in human clinical studies to be useful. Rather than going on a wild goose chase looking for all kinds of wacko things, this will give you the best scientific understanding of what you can do that's effective. So you should download it right now. Now, at machinohealth.com, you'll see my other research papers. These are review papers that I have on many subjects, as well as other videos, footage from my live professional seminars, other resources and downloads I've created. They're there for free that you can download to help you lead a long, healthy, functional life, not just to stay alive with a heartbeat, but to be really functional and vibrant as the years go by. All the research papers that I have in my teaching materials have all the scientific references right there, so you'll know you're getting only sound scientific evidence-based information on any health topic that you're looking for. So you really should make machinohealth.com an ongoing, reliable resource for health and wellness information for both you and your family members. Thanks so much for watching.